Magandang araw po muli sa ating mga tagapakinig. Magandang araw po, Doc. Magandang araw mga classmate. Ngayon po ipagpapatuloy natin ang ating pag-aaral. Jing Essence, number 5 na po tayo. Essence produces marrow. Concept of marrow in Chinese medicine is different from that in Western medicine. Does not correspond directly to bone marrow. Essence produces marrow, which in turn produces bone marrow and fills spinal cord and brain. Thus, marrow is substance which is common matrix of bone marrow, brain, and spinal cord, no equivalent in Western medicine. So pag Western medicine po, wala siyang equivalent ang ating essence. Essence produces marrow. So, ang essence is extremely important for healthy bone marrow, brain, and spinal cord. Brain is sea of marrow. So, kung ang kidney essence po ay weak, ang brain din natin ay lack of nourishment. So, magkakaroon po ng poor concentration, tsaka yung memory, mahinang magmemorya, yung madali bang makalimot, at saka nagsasuffer from dizziness, at saka feeling of emptiness of the head. Yung parang walang laman, walang maalala, yun po yung hirap, yung nahihirapan silang makaalala. Halimbawa may kukunin, pumunta mo doon, pagdating sa isang lugar na pupuntahan niya para may kukunin, nalilimutan. Kaya babalik para maalala. So yun po yung problema kung may weak ang kidney essence. Okay. Essence as basis of constitutional strength. So, essence determine our basic constitutional strength and resistant to exterior pathogenic factor. So, napakahalaga po ng role niya, ano? So, yung lakas ng katawan natin at saka yung paglaban sa mga exterior pathogenic factors, yung nagiging sanhi ng sakit, ay malahalaki ang role ng essence. So, although defensive Qi is mostly responsible for protection from exterior pathogenic factors, siyempre yung defensive Qi natin, siya din yung panlaban ng katawan natin para sa mga pumapasok na lamig, init, hangin. It draws its strength and has its root in kidney essence. So lalakas ang defensive Qi kung ang ating kidney essence ay healthy. So thus kidney essence also plays fundamental role in protection against exterior pathogenic factors. So ganun pa, no? Kung malakas ang ating kidney essence, protektado tayo kahit anong mga external pathogenic factor sa paligid natin, hindi tayo agad magkakasakit. Okay po. So, essence as basis of constitutional strength, yung lakas ng ating pangangatawan. So, if essence is properly stored, not dissipated, no exterior febrile disease will be constructed in spring. So, if essence is not stored in winter, exterior febrile disease will be contracted in spring. From these four main functions of the essence, one may deduce the kind of problem that may derive from deficiency of essence. So, ito yung pangunahing role ng ating essence. Siyang namamahala sa growth, reproduction, and development. So, stunted growth in children, poor bone development, and fertility, habitual miscarriage, mental retardation in children, bone deterioration in adults, loose teeth, and hair falling out of graying prematurity. So kung mahina yung ating essence, yun po yung nangyayari. So the essence as basis for kidney Qi. So kung mahina ang kidney Qi, ito pang mangyayari ano? Poor sexual function. So nagkakaroon ng impotence, weakness of knees, tapos nagkakaroon ng nocturnal emission, tinnitus at saka deafness. Kasi alam naman natin yung ear is external ano yan ng kidney. So the essence as the basis of bone marrow. So nagkakaroon ng poor concentration, poor memory, dizziness, tinnitus, and feeling of emptiness of the head kung mahina ang ating essence as basis of marrow. Number 4, essence as basis of constitutional strength. So, being constantly prone to cold, kung mahina ang ating essence bilang constitutional strength, madali tayong magkasakit, nagkaroon ng influenza and other exterior disease tulad ng allergic rhinitis, yung madali kang hinahatching, konting lamig o init, nagkakaroon tayo ng karamdaman. So, ibig sabihin po nun, mahina yung ating essence. So, essence as basis for three treasures. Essence and Qi are material foundation of mind o yung ating Shen. So, ang essence, Qi, mind, or Jing, Qi, Shen. So, ito yung fundamental physical and physic substance of a human being. Ito yung three treasures. So, essence, Qi, mind also represent three different state of condensation of Qi. Essence being densest, Qi being more rarefied, mind being the most subtle and immaterial. Subtle na bubulol. Essence as basis for three treasures. Essence and Qi are material foundation of mind. Ay, bumalik po yata, Dok. Bumalik ba, Dok? Sabal pala yan. So, essence as basis for three treasure. According to Chinese medicine, essence and Qi are essential foundation of mind. If essence and Qi are healthy and flourishing, so mind will be happy and that will lead to a healthy and happy life. Siyempre, kung maayos po yung ating essence, maayos yung ating energy, so magkakaroon tayo ng malusog na pag-iisip. Kung malusog ang ating pag-iisip, magiging masaya tayo, magiging masayang buhay. So if the essence and Qi are both depleted, so kung mahina yung essence, yung energy mo, yung pag-iisip mo, syempre ang magiging ano din po nun, ang resulta, then the mind necessarily will suffer. Siya yun yung nagiging kulang ka sa pangunawa. Nagkakaroon ng problema sa relasyon sa mga tao. Kaya yung healthy life and happy life nawawala kung ang essence and Qi ay weak. Yun po yung mga effects sa ating katawan.
Thank you very much, Ma'am Mildred. We will, she will continue tomorrow po. Okay. Any questions? No questions.
Ang halaga, Dok, nung essence, kaya di ba maraming tao ngayon, parang ang buhay, hindi magkakadugsong yung pag-iisip. Di ba maraming ganun, Dok? Doon pala yung nagmumula. Pag yung essence ay mahina from the kidney, naapektuhan niya yung mind.
Ganito kasi,
Kaya,
hindi magkakaroon ng magandang Qi pag mahina yung essence ng Jing. And kung mahina both ang Jing and Qi, magkakaroon ka talaga ng mental issues. So all these three are very, very essential. Kailangan po, una-una, we need to make sure that our Jing essence is constantly replenished by the post-heaven essence. Mga namanan natin, we can't do anything about it, but it doesn't mean na no matter what you do, you will end up having all the negative issues ng iyong mga ninuno, no? Now, if you have a very well replenished essence or Jing, then it follows that you will have a very good Qi. And Qi is the one that keeps things moving. Without Qi, then all the organs will be out of balance. And of course, pag lahat po ng Qi maganda, and which, of course, hindi ka naman magkakaroon ng magandang Qi kung mahina yung essence, then you will have a healthy mind, happy mind. Yun lang.
Kaya ang laking epekto, Dok, nung pandemya kasi marami nun walang trabaho, so walang magandang kinakain din yung mga tao, walang pang-replenish sa Qi. Kaya ang daming depression.
Kaya nga, I'm very excited because siguro, hindi lang ngayon, no? I would like to really push yung mental health. A lot of people cannot understand what really mental health is all about. They do not realize na galing po siya sa you have to have a very strong foundation. So if you treat somebody with mental health issues, it is not just about calming the mind, no, or making people think positive, whatever. It's about realigning the Qi. It's about bringing back the Qi, and that can only happen if ang hirap no? So yun dapat maintindihan ng lahat.
Parang kailangan may address, hindi lang yung sa health, pati sa economic.
Yeah.
Ano, Doc? Para maayos din yung mind.
Kaya yun, tuloy-tuloy. We will continue with the essence tomorrow. So I think
Thank you.
yun na po yun. Maraming salamat po, Ma'am Mildred. Thank you so much. Next, we will now go to tongue diagnosis. And we're very fortunate to have with us this afternoon, Ma'am Rowena Agatha Manlapas. So apelyido pa lang, medyo bigati na naman. So we're very honored to have her. She will talk about...
Thank din po si Ma'am Rowena, si Ma'am Rama.
Okay. So we will talk... Rama ba yung ano, yung kanyang acronym?
Yes po, exactly.
Ang ganda ng boses. So siguro maganda din ito sa personal. But anyway, so let's now proceed to tongue diagnosis. Ang topic niya will be a continuation of tongue body shape. Maraming salamat po.
Thank you so much, Doc and Ms. Mildred. So here we go with the tongue diagnosis. Okay, short, transverse cracks on the sides are a clear sign of spleen yin deficiency. This is not common, and it is not a condition often described among the spleen patterns, because usually po spleen yang deficiency, right? So such cracks are the easiest way to identify such a pattern. Short, transverse cracks behind the tip in the lung area usually indicate a past lung pathology, such as pneumonia, whooping cough, or repeated lung infections during childhood. As such cracks reflect past pathologies, they do not have a major clinical significance. So there you go. So ito po yung, these are examples of transverse spleen cracks. So they're kind of horizontal at medyo nasa gitna at the center, signifying that it's in the middle jowl, right? With the spleen and stomach there. So this is an actual picture of those. So sometimes you'll see this and medyo dry na po, ano? Red, and those are clearly, ayan po, kitang-kita po yung transverse crack, stomach crack, plus the stomach crack at the center.
Yeah.
Ngayon, ma'am, dahil sa sobrang init, baka may mga ganyang tongue.
Yeah, malamang po.
Usually, pag may nakita tayong spleen cracks, it would always follow na we have also stomach issues, di ba? Kasi they work closely together eh.
Yeah.
Diba?
Eat in the stomach din yan, Doc. Sigurado.
Yeah, and I'm sure with a voice like that, ang dami na nating followers. Bakit ngayon ka lang namin? Thank you po.
Careful. There you go. So these are lung cracks. As you can see, nasa outer portion siya. So nandyan po yung area ng heart and lungs. So the sides are the lungs, upper part, upper jowl.
Usually when you have lung cracks, if I'm not mistaken, it would mean that you have a very weak constitutional very weak constitution.
Yes, Doc. Madali yan sipunin, konting ano lang po ng panahon.
Baka yung mga grandparents mo or yung parents mo mismo had lung issues. I usually see this on my patients and they would always say, okay naman daw yung lungs. But, you know, these are the people who have to be very careful kasi they are very, very prone to probably lung. Alam naman natin yung lung is always associated with grief and sadness. Yes. So, or they could be very prone to lung issues, no? Pulmonary infections.
Yeah, also allergies, Doc, diba?
Yeah, allergies, yeah.
Whether skin or allergic rhinitis.
So this is something that is already a red flag na they have to be very cautious, especially ngayong panahon na medyo hindi na masyadong fresh ang air, no? Thank you po.
So short transverse cracks behind the tip in the lung area usually indicate a past lung pathology such as pneumonia, whooping cough, or repeated lung infections during childhood. So I think I've read this earlier. So wala po siyang major significant clinical importance. Okay, so an extremely deep if it's already a past issue. So just to make it clear, so an extremely deep midline crack with other small cracks branching out from it, usually seen in a red tongue without a coating, indicates a severe kidney yin deficiency with empty heat in the kidneys and heart. So I've seen someone with that po, like I've had a patient who was very depressed, very, very depressed woman kasi she found out that her husband was having something. And nagulat ako na sobrang ganun yung tongue niya. Exactly like what we saw earlier. So too many cracks, kidney yin deficiency and heart yin deficiency po. Very red.
Or probably these are the people who are not allowed to be emotionally stressed because they can easily get affected, no? 'Di ba? Kasi ang hina na ng constitution nila, 'di ba?
Yeah.
So probably this explains why some people are so depressed, right? Madaling ma-depress.
So there you go, deep midline crack with small cracks at the center.
This is not necessarily something that we should be afraid of, or is it something that can forewarn us to be very careful with the stomach? Probably, kasi diba, this is stomach crack, right? Saka may small crack siya. Para siyang, it's a very unique design. So probably these cracks, it's horizontal, no?
Opo. May naging ganyan akong pasyente, Doc, pero after 1 week, tinutulungan lang, siyempre, iinom siya ng tubig plus yung emotion niya, plus yung maayos na pagkain, nawala po yung crack.
May nakita din ako yung tuloy-tuloy hanggang sa tip. I think this will be taken up by Ma'am Agatha. I love the name Agatha. It's very un-Filipino.
It's the name of a saint. Okay, so let's talk about deviated tongues. The deviated tongue turns to one side when extended. So hindi po yan sinasadya. It's not intentional. So if you ask the patient to just put out their tongue, and if you see na it naturally turns to one side, you have to take note of that, okay? The most common clinical significance of a deviated tongue is internal wind.
Right.
And this type of tongue is most commonly seen in the elderly. In a young person, it may be related to a heart deficiency. There you go. So hindi po yan sinasadya. Relax po yan. Once you tell them, put out your tongue, and it naturally goes to one side or the other. So take note of it right away.
Yeah, you can ask him to put out his tongue again. So pang ganun pa rin, talagang...
Yeah. So let's talk about moving tongues. The moving tongue moves slowly from side to side with large amplitude movements when it is extended, and the patient cannot control its movement. It always indicates internal wind and is usually seen in the elderly. So here, when you talk about moving tongue, is different from the next one, which is quivering. So this one goes slow and medyo the movements are bigger. And they cannot be controlled. So it's just like that.
So also very common in the elderly. Quivering.
Quivering. So this is what I'm talking about. It's the opposite of that. So the quivering tongue trembles rapidly with small amplitude movements as it is extended. The most common clinical significance of a quivering tongue is chronic conditions like spleen qi or spleen yang deficiency.
I've seen this in a patient who is so fond of going to the gym. He said na he would spend like 3 hours. Sabi ko parang sobra naman yata yan. And di ba pag sobrang pawis ka sa gym, it follows that, of course, when you lose a lot of sweat, when you sweat a lot, the next thing that would follow would be blood deficiency. So with blood deficiency, you can have qi deficiency. I think this explains it. He was in his late 30s or early 40s. Pero, yun nga, pag pinastick mo yung tongue out, if you were not observant enough, no, makikita mo talaga, pag observant ka pala, talagang may konting may mga miniature, ito na, small amplitude movements. And it's very rapid. Yeah.
Maraming case din pong nagko-quiver yung mga na-stroke. Pero syempre, pag pinalabas po natin yung tongue, pag matagal din nakalabas na, nagko-quiver na rin siya. Kaya dapat
I don't know
babalikan
if if it makes sense, no? Usually pag medyo maedad na, mabilis yung large amplitude siya. And it's a bit slowly. Pero pag maliliit, it's rapid. And it's more common amongst the not so old. Yeah.
So tooth marked. The tongue with teeth marks indicate chronic spleen qi deficiency. However, because a tongue with a normal body shape can have teeth marks, do not assume that the presence of teeth marks necessarily mean the tongue is swollen. So sometimes you'll see that people have teeth marks, so very indicative of spleen qi deficiency. There you go. So that's how it looks like in picture drawing. So sides. And here is an actual picture of a person who has teeth marks in his or her tongue. Ganyan po. I used to have a tongue like that. Mas grabe pa dyan when I was diagnosed with, that was way back in 2016 po. I was diagnosed as hypothyroid. Eh, di ba ang hypothyroid, malamig ka, you're damp and cold. So it's spleen yang deficiency. There you go.
Interesting.
Yeah, I was able to reverse it po just using acupuncture.
Yeah, that's amazing.
Yeah.
Opo. Pwede po
Kailangan
siyang bumalik sa
ma-reverse.
normal.
Kaya nga, we would like to spread the gospel of acupuncture by actually encouraging everyone to have a monthly or twice a month acu sessions, even if they do not have any issues. Kasi if everybody would just take a look at their tongue, everybody looks at his tongue every time one brushes his teeth, diba? So why not, bakit hindi natin i-educate yung mga tao here? So if you see a tongue like this, even without symptoms, sometimes they will not tell you they have symptoms unless you ask them yourself.
Yeah, they don't realize that they have symptoms because they think that it's normal for them, diba?
True.
Ganun po.
So thank you po talaga. And I think you're very ready to give a talk on, would you like a topic on depression, Ma'am?
Yeah, yes po. I would love to.
Yeah.
Oh, okay. Kasi I was thinking, sige, off ko muna ha. Ito. Thank you very much, Ma'am Agatha. Are there any questions? Okay, if there are none, we will proceed to diagnosis by interrogation. Okay, we are still on the topic of feeling of cold and fever. Now we will talk about chronic fever. So this is different from acute fever. Okay. So when you have chronic internal fevers, this could be a deficiency or an excess condition. Very common po yung yin deficiency, and this is a very obvious cause of chronic internal fever, but chronic fever can also be caused by qi and blood deficiency. Among the full causes or excess internal causes of internal fever, we have liver qi stagnation that has turned into heat and blood stasis. So there are 5 main causes of chronic internal fever. Empty heat from yin deficiency, qi deficiency, blood deficiency, stagnant liver qi turned into heat and blood stasis. Okay. Let's start with empty heat coming from yin deficiency. We have the pathognomonic signs and symptoms like low-grade fever or feeling of heat in the afternoon or fever or evening. So sometimes the patient will ask you, why is it na parang pakiramdam ko sa gabi medyo mainit? So you start asking if meron ba siyang 5-pound heat. Take note of the malar flush. Okay, ask the patient if he feels thirsty, but would only drink in small sips. At night ba, dry ba yung mouth and throat niya? Mental restlessness ba siya? Night sweats, insomnia, dream disturbed sleep. So these are all very heat, dry stools, dark scanty urination. And check the inside of the lower eyelid. So meron kayong makikitang thin red line on the palpebral conjunctiva. The tongue is obviously red without coating, so this is very deficiency with empty heat. You will also see cracks. The pulse is fine and rapid kasi nga very deficient. These are the general symptoms of empty heat deriving from yin deficiency. They can also come from the lungs, heart, stomach, spleen, liver, and kidneys. So other accompanying symptoms, according to organ involved, okay, if it's the lungs that are involved, so merong dry throat, dry cough, malar flush. So if one has insomnia, mental restlessness, dream disturbed sleep, malar flush, red tip of the tongue, this is a red flag sa heart niya. Spleen, dry lips, dry stools. Liver, dry eyes, dream disturbed sleep, red sides of the tongue. Kidneys, dizziness and tinnitus. Stomach, I used to have this before, bleeding gums and dry mouth. Pero hindi ko pa alam na kaya pala walang coating yung tongue ko. I also have 5-pound heat. Yon. Every time I have my massage, the masseur would ask, bakit ang init ng chest nyo, pati yung aking kamay at yung pala yun. So I had yin deficiency. And now, medyo nag-iba na, nag-evolve na siya. Alam niyo naman pag medyo hindi na pasyadong bata. Anyway, let's now go to another cause of chronic fever. We have qi deficiency. So the key word here would be aggravation, no? So the low-grade fever or feeling of heat is aggravated when one is overworked, when one feels dizzy, tired, depressed, there is muscle weakness and spontaneous sweating, okay? Shortness of breath. So this is very qi deficiency. Loose stools, that's spleen qi deficiency, poor appetite, as well as poor appetite. Weak voice, this is very lung qi deficiency. Tongue is pale, pulse is very weak or empty. The fever is caused by severe deficiency of the severe qi deficiency of the spleen, stomach, and lungs, and deficiency of the original qi. So this situation was described by Li Dongyuan in the famous classic discussion on stomach and spleen. Sabi niya, overwork and irregular diet will weaken the qi of the stomach and spleen and the original qi. So it shares a place with the physiological minister fire. Now, if the minister fire is stirred by overwork and emotional problems, it becomes pathological. It displaces the original qi in the lower field of elixir and rises upwards, causing a low-grade fever or feeling of heat. So it's more of like a collaboration with the minister fire, especially when one is so overworked. No? So here you have a, how do you call this? A flow chart, a schema. Okay, so if this is about the psychology or the pathology of the internal fire, no? So the minister fire will actually displace the original qi. And when the original qi is displaced, this can cause deficiency of the stomach and spleen. And there will be exhaustion, feeling cold. Now, the minister fire will also collab with the if it's too much, it becomes pathological. So this is when it already harasses the heart and pericardium. So magkakaroon ng anxiety, depression, feeling of heat in the face, red cheeks. Okay. So sabi ni Li Tongyuan, the pathological minister fire is like the thief of the original qi. It actually depletes your original qi. The heat generated by the pathological minister fire is called yin fire. Hindi po siya full or empty heat, although it is more similar to the empty heat. This yin fire is not treated by clearing it with bitter cold herbs, but by tonifying the original qi with sweet warm herbs. As the minister fire and the original qi share the same place, tonifying the original qi will automatically, so it's basically tonification that one should be performing, no? Tonification of the original qi. The representative prescription, although we're not focusing on the herbs dyan po, no, to subdue the yin fire. Incidentally, attend po kayo. Ako po yung chairman kasi ng education department ng PAI. So we would like to invite you on Saturday, 6 p.m. I hope you can come. We have Dr. Philip Tangatwe, who will teach us how to incorporate herbology into our acupuncture practice, although most of us don't prescribe herbs. This condition of yin fire and feeling of heat deriving from qi and blood deficiency is very common today. Okay? Kasi ngayon, you need to really work hard because times are hard. So nagkakaroon po ng chronic fatigue syndrome, and also, when you have a very out of whack na immune system, you can have lupus or rheumatoid arthritis. Thank you very much.
Doc, hello, Doc.
Yes.
Yung RA, Doc, pwede rin pong galing sa mahina yung kidney essence.
Yeah. Actually, when you have RA, may kinalaman po talaga naging pathological po si Minister Fire. Yun. Kaya dapat, hindi pa naging pathological, inaayos mo na yung DO4 and bladder 23. Diba? And make sure na talagang in sync siya with the fire element. Okay? Diba? Kailangan may harmony ang heart and kidneys. And this
Yes.
kasi, yun nga, matanda ka na, nagtatrabaho pa, so sobrang yin deficient na yung mga tao. So what happens? So there will be empty heat, and eventually this will turn into fire. Yun. Okay? Ganun talaga. So I think that, RA is, I think that's the reason why it's called B syndrome, which is very common.
Pero at least nagre-response po ang RA sa acupuncture.
Yes.
Na lilesen niya yung mga pain at nawawala niya.
Kaya dapat marunong tayo sa tongue. That's the only way we can monitor the patient. Okay. Although we may not exactly have a normal tongue anymore, but pag nakikita mo talaga kung nag-i-improve yung treatment, yung pasyente sa treatment mo. Thank you po, Ma'am Mildred. Next, we go to Paul's diagnosis. Ma'am Mildred, can you take care of it? Your favorite topic.
Yes po, Doc. Si Ma'am Nitz nakasin din siya. Hindi kaya siya busy sa travel.
This one is very important.
Okay po.
Ma'am Mildred, yeah.
Magandang hapon, umaga po ulit. Hindi pala, Magandang araw po ulit. Ang ating pong topic ay ang pulse diagnosis, number 80. So, pulse qualities indicating dangerous conditions. Tingnan po natin. So, pulse qualities indicating dangerous conditions. Traditionally, there are 10 pulse qualities that indicates dangerous conditions and a poor prognosis. The 10 dangerous qualities are boiling cauldron pulse, circling fish pulse, swimming shrimp pulse, leaking roof pulse, pecking bird pulse, untying rope pulse, bouncing stone pulse, upturned knife pulse, spinning bean pulse, sesame seed hasty pulse. So tingnan po natin tong boiling cauldron pulse. This pulse is in the skin. So pag pinatong natin yung ating kamay, mararamdaman agad natin. Ito ay floating and extremely rapid so that it cannot be counted. Sa bilis po hindi nyo mabibilang. It feels like water boiling furiously in a cauldron. It is without root. So mabilis po talaga siya. Diba na-imagine nyo kung paano yung kumukulong tubig? This pulse indicates extreme heat in the tree-young and complete drying up of yin. So pag ano na po yung pulse, halos wala na pong yung fluid ng katawan ay nauubos. Talagang puro init na. So pag boiling cauldron pulse naman po, this pulse is in the bumalik ba? Floating, this pulse in the skin, floating and extreme, bumalik na po. Ito, circling fist pulse. Tingnan natin itong circling fist pulse. This pulse is in the skin. It is like a fish with a head still and the tail waving and shaking. So it is sometimes there and sometimes not. So mararamdaman natin minsan hindi. So mabilis din po ito, extremely rapid. So ang pulse pong ito ay ang nagsasabi na may extreme cold in the tree yin and collapse of yang. So sobrang baba na po nung yang at cold na talaga yung nandun sa katawan. Okay. Swim pulse. This pulse is in the skin, but its shape is somewhat hidden. Sometimes it comes, sometimes it does not. So, mararamdaman mo, minsan wala din. Tapos bigla mong mararamdaman na parang tumatalon like darts, like a shrimps. So, imagine po ninyo yung shrimps na tumatalon. So, this pulse indicates collapse of both yin and yang. So, ibig sabihin, ito yung mga chronic condition na ng katawan na halos napakababa na ng yin and yang ng katawan. Pag leaking roof pulse naman po, this pulse is in between the muscles and sinews. It is like water dripping, one drop at a time, at long and even intervals. Its drop splashing without strength. So, imagine po ninyo yon na parang pagpatak ng tubig na walang kalakas-lakas ang mararamdaman nyo. So, this pulse indicates collapse of qi in the stomach and spleen. So, para sa stomach and spleen po yun, weakness of the stomach and spleen. Okay, next. Pecking bird pulse. This pulse in between the muscles and sinews. It is rapid and irregular. Stopping and starting. It is like a bird pecking at food 3 then 5 times in a row. Stopping and starting at irregular intervals. So pag yun po yung naramdaman nating pulse na yan, nagsasabi po siya ng exhaustion of spleen qi and food qi o yung gu qi. So doon po siya nagkakaroon ng deficiency sa spleen. Pag untying rope pulse naman po, this pulse is in between the muscles and sinews. So, nararamdaman po natin yan pagkapatong ng kamay natin na sa mababaw na bahagi siya. So, it is rapid and beats chaotically at irregular intervals. This pulse indicates collapse of kidney qi. So, yun. Pag bouncing stone pulse naman po, this pulse in between the muscles and sinews and like a finger tapping hard on a stone at irregular intervals. So, this pulse denotes exhaustion of kidney water. So, yung kidney water na po ang may problema doon pag bouncing stone pulse na. Pag upturned knife pulse, this pulse is like the blade of a knife. Upside down, it is thin but hard, intense. Sa superficial level po ito nararamdaman, halos napakanipis, hindi mo halos maramdaman. Hard and tense. At the deep level, it is large, hard, and tense. So pag diniin mo po, so mararamdaman mo parang large, hard, and tense. This pulse indicates exhaustion of liver and kidney yin. So liver and kidney po yung naapektuhan na organ, yin deficient. Okay. Pag spinning bean pulse naman po, the pulse feels as it is in where spinning. So it is short and moving and feels like the coic seed semen coices, the crema jovi ren. So it feels also like rolling first. Imagine po ninyo yung parang gumugulong na maliit na perlas. So ganun yung nararamdaman spinning bean pulse. So this pulse indicates exhaustion of all internal organ. So lahat ng internal organ natin ang may disease. Sesame seed hasty pulse. Itong pulse naman po na ito ay mabilis siya at biglang humihinto at irregular interval like the hasty pulse. So it is small in shape like a sesame seed. So maliliit lang po yung kanyang pulse na mararamdaman mo. So this pulse indicates exhaustion of chi and blood. A common characteristic of most of the danger pulse qualities is the irregularity of the beat. They therefore indicates the pathology of the heart in a Western sense. Many of them are also rapid, indicating not necessarily heat, but a complete collapse of chi and blood, which makes the pulse rapid. So yun po yung mga danger sign. Okay po, thank you.
Thank you very much, Ma'am Mildred. May na-encounter ka na ba any of those 10?
Karamihan po, Dok, yung mga fast pulse.
Okay.
Siyempre, pag hindi deficient, mga naghihingalo na po, mararamdaman yun.
Yeah.
Chronic po yung mga situation na yung mga danger pulse na po yun eh.
Totoo. Anyway, thank you very much, Ma'am Mildred. We now proceed to differential diagnosis. Let's call on Ma'am Neets. Good afternoon po, Ma'am Neets.
Good afternoon, Doc Hector, and good afternoon, classmates. How's my audio, Doc?
Very clear po.
Thank you. Welcome to RTCM Foundations, number 181, Liver Wind Harboring Phlegm. Okay. Okay. Liver wind or liver wind steering internally is internal wind arising from extreme yin or yang and qi and blood imbalance when excessive depletion of liver and kidney yin. Okay. Etiology or causes: repressed anger, raw, sweet, and or greasy foods. Underlying and or accompanying pathology: stagnation of liver qi, liver blood deficiency, spleen qi deficiency with dump obstruction, lung qi deficiency. Dito naman tayo sa sign and symptoms. May headache, dizziness, feeling of heaviness in the head, blurred vision, occipital stiffness, tinnitus, nausea, pagkahilo, cough with sputum, nausea yung nasusuka, cough with sputum, insomnia, dream, disturbed sleep. Okay? Ang pulse kapag pinalpate mo ay wiry and slippery. Ang tang naman kapag tiningnan mo ay stiff, swollen with sticky coating. So, ang treatment principle kapag may patient tayong ganyan ay calm the liver, extinguish the wind, transform phlegm, and calm the shen. Okay? Ang acupuncture treatment na points na gagamitin natin: liver 3 courses the liver qi, subdues the wind. Okay? LI4 regulates the face, eyes, nose, mouth, and ears. Liver 3 and LI4 opens the gate. Remember? Okay. Stomach 8 eliminates wind, benefits the eyes. Spleen 6 supplements the spleen, regulates the liver. Stomach 40 kasi may phlegm, so it resolves phlegm. GB 20, gallbladder 20 is eliminates the wind, and REN 12 harmonizes the middle burner, and pericardium 6 calms the shen. Okay, ang technique ay needle with drainage or even method. Okay. Thank you very much po.
Ma'am
If you
Neets,
have questions.
Ma'am Neets, siya yun yung mga pasyente na yung nagpuutal-utal na po kasi yung 'di ba nag-stiff na yung tongue.
Kasi may mga phlegm na siya, malala na kumbaga.
Opo, siya yun yung nahirapan na magsalita.
Mm. Yes, Doc. Yes, Ma'am Mildred. Thank you po, Doc.
Thank you very much po, Ma'am Needs. Now we go to acupuncture patterns and practice. May we call on Ma'am Rama. Okay, so topic is vomiting. Okay. Good afternoon po ulit.
Good afternoon again. Here we go with acupuncture patterns and practice regarding vomiting. Vomiting is caused by abnormally rising of the stomach qi in retrograde fashion and propelling the food in the stomach upward. In a narrower sense, vomiting is the throwing up of food accompanied by sound. Throwing up without sound is called spitting up, and sound without throwing up is called retching. So there's a difference in those. So I guess you'll be able to notice people because they really make noises when they're vomiting, right? So let's go to the etiology and pathology. The principal causes of vomiting are attacked by exogenous pathogenic evils, intemperate diet, and internal injury by the passions. So again, it's parang rebellious stomach chi ito. Sometimes they call it that in TCM. So let's talk about attack by exogenous evil. This is mostly attacked by wind, cold, summer heat, dampness, or another of various turbid factors. Such an attack injures the stomach and causes it to fail in its functions of harmonization and descent, or of going down, right? The stomach chi should be going down, not going up, forcing stomach chi to ascend abnormally in retrograde fashion. Whatever is in the stomach can follow stomach chi in its abnormal movement, and vomiting results. In general, sudden vomiting is mainly due to these exogenous evils attacking the stomach. In summer, it is mostly summer heat or dampness. In autumn and winter, it is mostly wind or cold. So depending on the season for that matter. Intemperate diet. An intemperate diet means mainly imbalance between hot and cold foods, overindulgence, excessive eating, or excessive raw, cold, greasy foods or foods that are hard to digest. Any of these can lead to indigestion and food retention, which in turn injures the stomach. When stomach chi is unable to descend normally as it ascends abnormally and induces vomiting, intemperate diet can also affect the spleen and the stomach and impair their transportation and transformation functions. So sira na yung rhythm, right? The essences from food and drink can no longer be extracted, and phlegm rheum would be formed. When phlegm and rheum rise adversely, vomiting can also result.
Hello, Ma'am Rama.
Yes
Kaya yung
po?
mga kumakain na pinagmi-mix nila yung na halimbawa naghahalo-halo tapos kumakain ng mainit na pansit. Sumayon.
Yeah. Sa mga parties usually, 'di ba? So sa mga
Opo.
buffet, eat all you can, usually ito nangyayari. So just be wary of what you eat and alam niyo lang po kung kailan tama lang ang kinain niyo kasi actually yung stomach po natin ay maliit lamang. Parang ang kasya daw po sa ating tiyan ay parang yung pag ginawa niyong fist yung dalawa niyong kamay at pinagdikit niyo, ganun lang daw po ang kasya talaga. So anything over that could really overwhelm the stomach.
Uso po naman ngayon yung eat all you can.
Yeah. Sarap eh, 'di ba?
Pag
Yeah.
eat all you can kasi, sinusulit yung binabayan.
Yes, exactly.
Hanggang pag-uwi, Doc, nagsuka-suka na kasi kinain lahat.
Mhm. Actually, this happened to me last year. Nagpunta kami sa beach and then of course there were a lot of food. And of course you want to try all of the food, 'di ba? So, yep. Nagkaroon ako ng retention of food and then that one. Okay.
Ako, pag yung ganyan, I only eat the food na hindi ko nakain pa before. Then
Mhm.
pagka lahat
Bago
Pag-uwi,
food for
continue
you.
pa na.
kasi pag yung nakain mo na, parang boring na rin, di ba? Kasi
Opo.
pag napuno yung tiyan mo, di mo na makain yung iba. So unahin mo muna, mag-reserve ka ng space sa tiyan mo sa mga pagkain na hindi mo pa
Hindi
nakain.
pa natikman.
Yeah.
Thank you po.
So internal injury by passions, anxiety, brooding, and rage. So these are really emotions, right? Na masyado, sobra, can all constrain liver qi movement. When liver qi becomes constrained, it moves abnormally and injures the stomach, leading to disharmony between the liver and the stomach. Stomach qi may then ascend abnormally and induce vomiting. Alternately, liver qi becomes pent up, transforms into fire, and forces stomach qi to move upwards. Anxiety and brooding also injure the spleen. When spleen functions are impaired, food cannot be readily digested and its essences transported and made available for generating qi and blood. The stomach then loses its ability to harmonize and descend. This also induces vomiting. Conversely, prolonged vomiting can itself injure qi and yin, leading in turn to insufficiency of the spleen and the stomach. So masama din po yung sobrang emotion. So right,
Yes po.
the liver can easily be affected by emotions, stress, emotions, mental, emotional stress, physical stress na nakakagalit ba, 'di ba? Kaya
Yes
sometimes
po.
people who are quite irritable na, you have to watch out for it kasi it might turn into something else, 'di ba? And this usually happens.
Yeah,
Actually,
pag
ma'am, pag
galit, wag na lang kumain.
opo. May ganun po akong pasyente, Doc, di ba yung sobrang galit niya kasi yung daan sasarahan. Eh, tamang-tamang kakain siya, sasaran yung daan, nagbabakod. Pinuntahan niya ngayon yung nagbabakod. Tapos bumalik kumain. Na-choke po siya, muntik mamatay.
Oh.
Mabuti na lang, yun,
Never
na-push
eat when
naman.
you're angry. Matulog ka na lang muna. Pagising mo, galit ka pa rin. Okay, thank you po.
Thus, though vomiting is primarily a symptom of stomach illnesses, it also involves the liver and the spleen. An illness with vomiting as a prominent symptom may be of strength or of deficiency. A strength illness is due to an exogenous evil, retained food, accumulated phlegm room, or liver qi attacking the stomach. A deficiency illness is due to deficiency of spleen and stomach qi and yin. In general, an illness in the early stages is likely to be of strength. Acute po yan, no? But if prolonged, it can easily transform into one of deficiency or one of mixed strength and deficiency. So let's go to the clinical manifestations. In addition to vomiting, these illnesses manifest principally food retention and much sputum and saliva, or a bitter and acid taste in the mouth, or retching. In an illness of strength, vomiting tends to be sudden or prompt following eating. Biglaan po, though it may also occur without eating. In an illness of deficiency, vomiting tends to be recurrent without pattern or paulit-ulit, or there is nausea and retching. What is vomited is usually food taken on that day. If vomiting is due to exogenous wind and cold attacking the stomach, the tongue coating is white and the pulse floating and tight. Tight because of the cold, right? And it's because it's exogenous, kaya po it's floating. If it is due to exogenous wind and heat, the tongue is red with a thin yellow coating and the pulse is floating and rapid for heat. If it is due to food retention, the vomitus contains acid and has a fetid, unpleasant odor. The tongue coating is thick and greasy and the pulse is slippery. If it is due to liver qi or fire attacking the stomach, the vomitus contains bitter and yellow water. Sometimes po yung mapait, right? The sides of the tongue are red with a thin, greasy coating, and the pulse is taut. If it is due to deficiency of spleen and stomach qi, giving rise to endogenous cold, the vomitus contains clear water, sputum, and saliva. The tongue is pale with white and moist coating, and the pulse is thread-like and feeble. If it is due to deficiency of stomach yin, The vomitus contains sticky foam. The tongue is red and dehydrated with scant coating, and the pulse is red-like and rapid. So in these cases, you will see right away with the quality of the vomit, yung nilalabas ng tao, anong kulay, is it thick or thin, doon yung malalaman po ang causes. Besides, of course, you take a look at the tongue and of course the pulse. You check the pulse as well.
Thank you very much.
Thank you also.
Wow. So, marami tayong natutunan today. So, let's continue with signs and symptoms naman. This time we look at the gums. Gum inflammation or inflamed gums. The first thing that we have to consider is the stomach heat pattern. So, aside from the inflamed gums, the patient will have foul breath. Okay, you will also note mouth ulcers on the lower gum, burning epigastric pains, sour regurgitation, nausea, excessive hunger, feeling of heat. So the tongue will be red with a yellow coating, so this is very heat, overflowing rapid pulse. Points, stomach 44, very popular, LI4, stomach 21, and LI11. Another consideration would be stomach yin deficiency with empty heat. So you will have inflammation of the lower gums, bleeding gums, mouth ulcers with a white rim, dry mouth and throat in the afternoon, thirst, desire to drink in small sips, dull or burning epigastric pain, feeling of it in the afternoon, dry stools, slight feeling of fullness after eating, night sweats, 5-palm heat. Tongue is red or the center is, only the center is red without coating in the center, floating empty and rapid pulse. Again, the points are stomach 44. This time, because this is a yin deficiency, we'll be using spleen 6 and REN 12, and also stomach 36, plus LI4 and LI11 for the heat. Other patterns to consider when you have inflamed gums would be invasion of wind heat. There is also, the classic aversion to cold and fever, cough, sore throat, stuffed or runny nose with yellow discharge. So this is very wind heat. Headache, body ache, slight sweating, slight thirst, swollen tonsils. The tongue would be slightly red on the sides, in the chest area or on the front part, and the pulse would be floating and rapid. Then we have the so-called purple leg teeth nutritional impairment pattern. The gums are swollen, inflamed, and bleeding, cracked lips, painful legs, swelling of the legs in patches like clouds, and also discolored like unripe aubergine seeds. Ito yung talong, di ba? Hardness of the flesh, difficulty in walking. There are actually two manifestations. Okay, one with damp cold, the other with toxic heat. So damp cold, of course, andyan yung feeling of heaviness, cold limbs, edema, ache in the joints. If there is toxic heat, bitter taste, dry mouth, thirst, foul breath, red tongue with red points, and thick, sticky, dry yellow coating, and an overflowing, slippery, rapid pulse. And then we have the walking crow teeth nutritional impairment pattern. In the beginning, you will see hard red nodules on the gum. After 1 to 2 days, the gums become inflamed and then turns grayish black. Bleeding gums that are neither painful nor itchy, foul breath, red tongue with sticky yellow coating, and this is more common in children. Maraming salamat po. We will now proceed to the last topic for today, asthma. Let's request Ma'am Mildred to do the honors.
Yes, Doc.
Ma'am Mildred, good afternoon po ulit. Nasa asthma pa rin tayo.
Good afternoon pong muli. Pagpapatuloy po natin ang ating topic sa asthma. 23, Modern Chinese Literature. Modern Chinese Literature. Dr. Hu Jinzheng discusses the treatment of allergic asthma with acupuncture. He distinguishes two main patterns in allergic asthma: Qi deficiency with blood stasis and lung and kidney deficiency. The main points he uses fall into two groups. They are divided as follows: Do20, Do23, Yin Tang, Bladder 7, Large intestine 20, Large intestine 1, Large intestine 4, and 17, Pericardium 6, Stomach 36, Spleen 6. And number 2 is Do14, Dingchuan, Gallbladder 20, Bladder 13, Bladder 17, Bladder 20, Bladder 23, and Bladder 25. So, mga backshoe points po yung pinili niya dito sa number 2. Okay po. The points used by Dr. Hu are interesting, as they are quite different from the ones used by other modern doctors. The first group includes many points from governing vessel, o yung tumay. And surprisingly, yung bladder 7 on the head, the inclusion of Do20 is also surprising. As this point flips Qi, something that one would want to do in the asthma when Qi needs to descend. The second group include group points that expel wind and points that tonify the lungs and kidneys. This is interesting from my perspective, as it would confirm my theory of wind being the main pathogenic factors and deficiency of the lungs and kidney. So yun po yung nakita niya doon sa kanyang second group. The underlying condition and allergic asthma. So yung wind yung pumapasok sa lungs na nag-affect sa lungs and kidney, kaya nagkakaroon ng asthma. Okay po, tingnan po natin. So, explanation of the points as follows. Do20 lifts the deficient Qi. Do23, Yin Tang and Large intestine 20, open the lungs or feces to make Qi descend. So yung bladder 7, as the name implies, make lung Qi penetrate. So, and promotes the exchange and communication between lung Qi and air. So yung lung 1 naman po ay front siya, collecting point of the lungs, regulate the lungs, and promote the descending of the lung Qi. So large intestine 4, ito po yung source or U1 point of the large intestine. So helps lung Qi to descend, thanks to the exterior-interior relationship between large intestine and lung channel. So yung REN 17 naman po, ang pericardium 6, so regulate the Qi mechanism. Pag stomach 36 naman, when spleen 6, tonifying the stomach and the spleen, which help to tonify the lungs. So yung earth being the mother of the metal. So the 14 po is a meeting point of all yang channels. So Dr. Hu does not say how exactly this help asthma. Dingchuan, so ito po ay Dingchuan and Chuanxi, Wanchun lateral to Do14 are empirical points for asthma. Special points po yung Dingchuan sa asthma eh. So GV20, ito yung nagtatanggal ng hangin. Bladder 13, backshoe points of the lungs. Bladder 20, backshoe points of the spleen. Bladder 23, backshoe points of the kidney. So tonify lungs, spleen, and kidney. Bladder 17 naman regulates blood, special point for the blood. So invigorating blood will help to move Qi. So Dr. Hu adds other points according to clinical manifestation as follows. So pag Qi deficiency, REN 6, spleen 10 to tonify Qi and blood. Lung and kidney deficiency, kidney 3, lung 9. Ang ingin ng aso namin. Cough, chest pain, ang gagamitin po ay kidney 26 and kidney 27. So pag profuse phlegm po, itchy throat, ginamit ni Dr. ay stomach 40, REN 22. Then literary increased voice, one tune lateral to the tip of the laryngeal prominence. So pag digestive symptoms naman po ay REN 12 at stomach 25. Pag may edema of upper limbs, third intestine 6 and lung 7. Edema of lower limbs, spleen 9, spleen 6, spleen 5. Dr. Ho recommends using the above two groups of points for 4 times a week initially, twice for each group. After 3 weeks, reduce the treatment to 3 times a week, using the first group twice and the second group once. Pagkatapos po ng 4 weeks, reduce the frequency to twice a week. So once for each group. Use even method after obtaining the needling sensation and needle Dingchuan to a dip of 1 to 1.5 tune. Thank you po.
Maraming salamat, Ma'am Mildred. Thank you everyone for joining. Hope to see you again tomorrow. Good evening po.